It is Santa Clarita's hometown station, AM 1220 KHTS. I am Kyle Jennings. Appreciate you hanging out with me for this noon hour. Every once in a while, once a month, we have a special show for you, the Providence Holy Cross Health Hour. And this week, it's Back to the Future Day. It's actually Back to the Future Day. And we're going to talk about futuristic type of medicine today with Associate Administrator, easy for me to say, Heidi Lenartz, and she joins us now from Providence Holy Cross. Appreciate you stopping by.
Hi, Kyle. Yeah. Yes, here I am up in Santa Clarita.
Yeah.
And glad to be here.
Normally, where do you call home?
I call home North Hills.
Okay.
Right by Providence Holy Cross and Mission Hills.
Right there. Okay.
Right around the corner.
So it makes the commute's not bad.
Not bad, and I'm one of the lucky ones.
Yeah, gotcha. Okay, so we're going to talk about specifically today telehealth and telemedicine, and we'll get to that in a little bit, but I want to talk about you a little bit, if that's okay. What is your background? Did you grow up in Southern California? What is your background?
Yes, I'm native, homegrown,
Nice.
born in Glendale, raised up in La Crescenta area, in the mountains, what are considered the mountains nowadays. And really...
They don't have all homes on them, do they?
They do. Now practically they're up the mountain.
So now they're neighborhoods.
Now
they're not
neighborhoods.
mountains. They're neighborhoods now, yeah.
So proud to say I'm a native Los Angelino, and
few and far between.
Very few.
Yeah, my dad grew up in Burbank. He born and raised in Burbank.
Wow.
And
another one.
Yeah, and he'll see people in line at a grocery store or something, and he'll say, "Oh yeah, I was born and raised in Burbank." And they're like, it's like a zoo attraction. He's like, "Hey, honey, check this out. He was born and raised in California. He hasn't moved." Yeah, so he's one
Most
of those.
people move no further than 50 miles away from their home. So just a factoid there.
Oh, there you go.
So
fun fact.
Loved La Crescenta. Went to college at LA Valley College for my associate's degree. Went to CSUN for bachelor's in psychology.
Great. Okay.
So truly homegrown, and then went to USC for a master's in social work. So I'm fight on.
Okay.
And proud of it. And actually then progressed into licensed clinical social worker, and that's my background.
Okay, so right now you're an associate administrator. So I want to ask you, where did you work post master's degree? Where were you working post master's?
So my story is I fell in love with working in hospitals, quickly moved to New York City, worked in Queens at a city hospital there, and really was part of an acute rehab unit and just loved it. Loved the treatment team, loved the environment, the purpose.
What does acute rehab mean?
Acute rehab would be physical therapy, recovering from orthopedic injury or having some sort of disease that requires orthopedic intervention.
Okay.
So that's a period of time people can spend in a hospital recovering and getting treatment and therapies. So,
oh, okay. And you were on the therapy side of that.
I was on the social work therapy treatment team side.
I didn't know that for injuries like that you needed a therapeutic type of training.
Some people might. For example, our trauma center at Providence Holy Cross, we do have an acute rehab unit at Providence Holy Cross and provide those services as people are stabilized on the medical unit. They'll transfer to acute rehab for further therapy, and then they'll transfer home from there.
Huh. So what type of injuries are we talking about? Well, obviously, trauma centers are pretty serious injuries. Are those people that can't walk anymore type of injuries? Or
yeah, unfortunately, in some cases, we might see someone riding their bike, door opens,
oh, man,
and they're injured. They fall to the ground. People falling from ladders can be serious injury.
Yeah.
Head trauma can be physical injury, broken bones, other sharp objects, motor vehicle accidents, gunshot wounds. We see it all.
And you would be the social worker for those individuals?
Our team would.
Or your team would, okay.
As associate administrator, I oversee a variety of clinical support departments, and one of those is clinical social work, care management, facilities, environment of care, and so forth. So I have a division of departments that I oversee. Yes,
awesome.
I'm happy to do that, and it's a great team of people at Providence Holy Cross.
Awesome. Okay, so that's why I want to backtrack a little bit more. So you were in Queens doing things.
Yes.
And what brought you back to the West Coast?
The weather, to be honest, honestly, really, 10 degrees compared to this beautiful day today. Yeah. Came back to Los Angeles and worked in At that time, I worked in an AIDS unit as a clinical social worker.
And what year was that?
That was 1990 through
so that was
1994.
like the height of that.
It really
that
was.
stuff.
And
so there was, that was right around the time the announcement was made by Magic Johnson, so it was a big deal.
That was a big deal.
Yeah.
And at that time, there were hospital units serving that population. And I'm happy to say that our team was part of one of the last units to be open, and we subsequently just left that unit and closed that unit. And,
for
happy
good
to
reason.
say, for good reason.
For good reason, yeah. The
People-
goal of those places are to close.
The goal was to close, and we closed it, and that was a good thing in those
Good.
days. So.
Good. And then so you were, where was that? That was
at that time Midway Hospital, what's now called Olympic Hospital. And then I proceeded into a new service line of psychiatry.
Okay.
And became program director of a psychiatric unit in the San Fernando Valley with Mission Community Hospital. And from there, variety of positions that, my focus in clinical social work was on public administration. Fell in love with administering programs and clinics, and hospitals were it for me. I really, really enjoyed the operational side. And I'm lucky to be part of what eventually joined the team at Providence Holy Cross, which was, in my neighborhood.
Yeah.
And it's just been a spectacular experience.
And you did you always want to do like social work or something like that in high school? Did you want to be an athlete or anything? Was there?
I think the systems aspect of clinical social work or social work, it's a psychosocial and biopsychosocial approach to human caring. And I think it takes into consideration the medical, the environmental, the social aspects of human development that is unique to that profession. And so that's why I chose it. And that's how I've really been able to take it into any position that I've worked in and apply it with Holy Cross quite a bit in a variety of ways. So it's really served me well. And really, I think when I went to USC University Hospital, which is now Keck Medical Center, when I did return from New York, worked there in case management quite a bit as director of case management there and overseeing social work. And that really gave me an opportunity to see the continuum of care and what we're talking about now in healthcare and the landscape of healthcare and the changing trends in healthcare. The continuum of care is what we're talking about, and how what I want to talk about now is how telehealth and telemedicine are going to be part of that transformation in healthcare.
Yeah, and that's what we're here mainly to talk about. I appreciate you sharing your story. That was very cool to get to know you a little bit. That was very fun. But tell me about telehealth and telemedicine. What is that?
So you probably may not think of it, but 74% of people are already engaged in telehealth. So if we think of telehealth, healthcare services delivered through telecommunication devices. So that can be anything from phone call between two physicians, or you scheduling your appointment with your physician on your computer.
Okay.
We can do that nowadays.
Yeah.
It can be your Fitbit. When you really think about it, people use the word telehealth and telemedicine a little bit interchangeably, but telehealth is really facilitating access and enabling access through telecommunication systems. So if we think of people are texting emergency rooms to find out wait times and things like this is telehealth and how healthcare services are delivered through telecommunications. Some of it. Simplistic, but that's some of it. Now, telemedicine would be really the delivery of medical services through professional staff, physicians, nurses, ancillary clinical services, through telecommunication devices. So really we're all familiar with PCs, phones, texting. Much of healthcare services today are using those devices to communicate, to exchange information, to deliver information. For example, you can look up your medical record. The Affordable Care Act has
no idea I could do that.
has encouraged all healthcare providers, physicians, and hospitals to implement electronic health records. It's a mandate. And majority of hospitals and physicians are already probably 100% of the way there, or doing their second generation of healthcare system. But all or most electronic healthcare records, or healthcare records today, are now electronic. Data is entered, by the care team into a computer system. It's compiled into a medical record of sorts, and then any member of the healthcare team who's approved to be on that case can actually access that record on a PC, on a station that stands in a hallway, for example. It's mobile. It can be transported into conference rooms for care conferencing. Pretty remarkable what we can do nowadays.
So it seems like telemedicine and telehealth, just from what I'm hearing you say, is it's kind of just any means of communication, electronic communication, dealing with health. But it seems like you guys are trying to maybe organize it a little bit better, rather than just saying, hey, we're texting the emergency room to see what's going on. You guys are trying to make an effort to organize it more. And then telemedicine obviously is a little bit different than that.
So telemedicine would use perhaps more advanced technology to implement medical practice. So let me give you a few examples. One example would be a robot, a Da Vinci robot,
That's
for
awesome.
example.
I love anything that gets robots more involved.
Talk about Back to the Future today. Where you have a physician or a practitioner specialist who actually would physically engage, let's say, the manipulations on a machine or a robot, and that ability to sensitively calibrate the robot's
Are you serious?
ability to make incisions and perform surgery, very minimally invasive surgery.
Yeah, I would. Yeah.
Is transformed surgical procedures, and some surgical procedures can be microscopic because of the sensitivity of the robot. And so that would be telemedicine of sorts.
This is blowing my mind right now, just so you know. Being
able to really provide medical care. It's also transmitting information. Perhaps the patient's lying on the table, has vital signs attached to the entire body.
Yeah.
All of that information is being wirelessly transmitted into the computer.
Okay.
And stored and accessible into the medical record, and can be referenced
just
at
as
any point.
It's like live vitals. And so the doctor could literally be anywhere with an internet connection
and see that,
and see what the vitals, what's happening with their vitals.
Talk about the looking at the military's use of telemedicine.
Oh my gosh. That's insane.
And they're performing surgeries across different parts of the world.
Okay, so we're speaking with the Associate Administrator Heidi Lenartz of Providence Holy Cross. This is the Providence Holy Cross Hour, and we're talking about telemedicine and telehealth. So I for some reason didn't put two and two together, but the doctor could be controlling this robot from wherever he is.
Yes.
And is it like virtual reality kind of a thing where he's got things on his hands doing it in
virtual?
What?
Yes.
This is crazy. This is crazy to me. This is, and that's okay. So, my mind is spinning right now. Doctors, do they even need to come to the office anymore? Like, what's the there's that balance? You know what I mean?
So really, let me talk a little bit about the purpose of telemedicine.
Love it. Yeah, okay.
So we have really the purpose is to achieve what in healthcare we might call the triple aim. So we have three really goals of care at this point in healthcare. To provide and improve service and access to healthcare services as we move into universal healthcare coverage, and that's my term, but making sure that more people have healthcare coverage. We see telemedicine and telecommunications and telehealth has allowed people to have more access. I could be at home and contacting a nurse practitioner to consult with who would tell me, perhaps you should go to urgent care, or let's say you should go to the ER. So that's just a form. The other aspect or point of triple aim is to improve quality. If I can improve quality through data analysis and data collection, and providing faster care, more timely care to a person through telehealth and telemedicine, we've achieved that goal. And through improving communication, that all those elements factor into improving quality of care. And thirdly, there's an incredible amount of resources spent on healthcare in the United States. And for over 20 years, there's been studies of existing data, healthcare data through Medicare and so forth. They've really studied this data and looked at the distribution of healthcare services across the country and utilization of healthcare services. And they see that in certain areas there might be ways to improve and be more efficient. And telehealth and telemedicine are definitely on the forefront of improving the efficiency of healthcare. So you can provide and you can reach out to a senior person at home, someone who can't leave their home. Let's say they have an iPad. Let's say that they can be linked wirelessly with a care manager, a nurse, a doctor. They are unable to leave their home. They're able to talk with people. We do it in social networking already in so many ways. Here's an opportunity for someone to be connected to a care provider and be monitored at the same time. So we're seeing this person doesn't have to drive to a doctor's office. The doctor isn't doing home visits, but in a way is. This person is in their home environment. Short of handing them pills to take or providing an infusion or an injection, they're being assessed constantly, or they could be assessed constantly. So it really has the potential to transform our healthcare services on a population type level of care across all groups, across all income levels, across all regions, for that matter.
This is an intense thing that's going on here. This is pretty gnarly. We're going to take a quick break. We're speaking with Heidi Lenartz. She's the Associate Administrator at Providence Holy Cross. This is the Providence Holy Cross Hour. We're going to take a quick break. More about telemedicine and telehealth coming up next.